Is there anything you can say? Thank you, Morgan. Jimmy, is there anything we can say or do to convince the NDIS or Centrelink that having had a Fontan is a form of disability? I think this initiative is in the hands of HeartKit, but please liaise with HeartKit. They're very sensitive to that question. Can you go from a Fontan back to a biventricular circulation through the ventricle recruitment in Australia? So, I can try to answer that in the dark. We in Australia have not gone back to biventricular circulation. I'm aware only of one case, and I think that after a few years of a Fontan circulation, your heart is not ready to go from a Fontan to a biventricular circulation. It's getting too small and too stiff, and it would be very difficult undertaking. The concern about pregnancy, what are the risks, the concern for someone who had a Fontan as a child and now an adult who want kids? So the concern of pregnancy are real. It's difficult to get pregnant. There's clear risk of having a small baby prematurely. And there's more risk of bleeding for the mom. In Australia and New Zealand, we've been able to have successful pregnancy with no early impact on the mom, and some good success with children, but it's not an easy undertaking. And the question that we ask ourselves that is unclear, and we're going to do international collaboration to answer that question, is that does that have an impact on the circulation of the mum once she's got a pregnancy on the long run? Okay, is there any research into developmental delays in Fontan kids? Yes, there is. If you have congenital heart disease, you're more at risk of decreased or impaired neurodevelopmental outcome. I would not especially talk about developmental delay, but what you can find out is that you can find, if you look for it very closely, with very fine investigation, you won't notice anything like that, but fine motor skill change and some cognitive skills impairment. So people who do not as well at school. One of the things is that it would be interesting to look at that, and it would be nice if the DHS was funding for investigation of these outcomes at about 3 or 5 years of age, before school age, because you can do something about it. You can provide a bit more support at school, and that would be efficient to put you back into the normal. Why do you have that is unclear. If you have a Fontan circulation, single ventricle or biventricular circulation, it seems that you don't have a difference. So you have as risk to have this than if you have a biventricular circulation. So we don't understand. We want to do a study that look at the things that can cause for that. So the things that can cause that is an abnormal flow into the brain before birth, abnormal maturation of the brain. And yes, the surgery may have an impact on that. Genetic issues may have an impact on that, but it looks like genetic malformation counts for about 25% of the difference observed in neurodevelopmental outcome between patients with a heart disease and people who don't have a heart disease. And surgery and all the events around surgery counts for only 5%. So the other 70% are genetically coded things that we do not understand, brain maturation before, socioeconomic impact as well. If you work more on your brain, maybe you have better brain. So there's research in it. Annie, okay, what are the arguments for and against fenestration closure? We had a case discussed at our conference today, and we had lots of discussion. And there's still a lot of disagreements. I have completely biased views myself, and take the opportunity to answer that. I think we'll find a difference, but right now we could not prove the difference. The people have said that if you have a fenestration at the time of the fontan, you tolerate the experience of the fontan at the time of the surgery better. Some evidence of that, but not consistent. So not everybody agree, but grossly speaking, it seems to be a benefit at the time of the surgery, but people disagree with that. On the long term, some people have said that if you have a fenestration open, you have an increased cardiac output. That's an increased cardiac output generally on anesthetized patients in a cath lab. You don't seem to have an increased exercise capacity. Most of the study done so far are unconclusive. That being said, if anybody who's got, like me, 98, 99% saturation, and I put myself or anybody with that level of normal oxygen saturation to a oxygen saturation of 5% less, even 92% saturation, I'll be struggling a lot. I mean, I just have to run an altitude to know that if I have less oxygen in my blood, I'm not going to be able to run that fast. So for me, it makes sense that if you have more oxygen in your blood, your exercise capacity will be better. And my little experience of people who are super fit fontan is that usually they don't have a fenestration output. But watch this space, we don't know, and we'll see. I think we'll know within the next 2-3 years. Thank you, Blake. I've discussed about the best age for fontan. Shouldn't wait, whether it's 3, 4, 5, or 2 or 3, I don't know, but you shouldn't wait too long. I've mentioned that at the beginning. I don't know about, I haven't heard before about tremor with a fontan. I would refer that question to a neurologist, and hopefully we have a neurologist participating to that at some stage, to participate in a Q&A. Okay, is that all? I think I have a question of Nicole, I think so.
Excellent. Well, thank you for your time. Well,
thank you very much.